cost of surgeon services, including the anesthesiologist's operating room, when not covered as a miscellaneous item. There's some terminology here that I want you to be familiar with. First, they use what's called a surgical schedule. The surgical schedule will list procedures that are covered under that policy. If your procedure is not listed on their surgical schedule, then it is not going to be covered. Next, they use what's called a relative value approach. What that means is that each procedure on that surgical schedule is going to have points assigned to it. The number of points assigned to any given procedure will be relative to a number of points assigned to a maximum benefit. So think of it like this. Think on the surgical schedule that the most severe complicated surgery is going to be at the top. And let's say it's open heart surgery. Well, then every procedure below that gets a little less severe, little less severe, little less severe. So let's say open heart surgery has 1,000 points assigned to it. Well, every procedure below open heart surgery is going to have points assigned to it, but the number of points assigned to any procedure below that will be relative to the number of points assigned to that maximum benefit of open heart surgery. Okay. Next, there is a conversion factor, and the words in your book are important. The conversion factor represents the total amount payable per point. So let me just kind of give you a quick thing here on this. So let's say you had open heart surgery at the top and it had 1,000 points assigned to it. And let's say they use a conversion factor of 10. So open heart surgery, 1,000 points, multiply that times 10. It means it would pay you $10,000 for open heart surgery. Once again, this is money coming to you. It's not going to the facility. Now let's look at that. Open heart, you have to have open heart surgery, 1,000 points assigned to it, going to pay you 10 grand. Is that going to be enough to cover open heart surgery? Well, obviously not. That amount of money barely going to get you in the hospital these days. Once again, that's why these are supplemental type policies, and they're not really good for everyday needs. But in conjunction with a major medical policy, they could be very useful.